Okay, let's unpack this. We are diving into a scientific area that sounds, well, incredibly specific, polymeric oleogels, but the implications are absolutely massive. This technology is quietly transforming two of the biggest human health challenges, nutrition and drug delivery.
It really is. It's truly a classic materials science challenge. How do you take a liquid oil, something inherently fluid like sunflower or maybe canola oil, and transform it into a solid structured material?
Right, because the old way involves stuff we're trying to avoid now.
Exactly. The traditional answer involved unhealthy saturated fats or even worse, trans fats. But the modern answer is the oleogel. It's a semi-rigid bicontinuous system where the liquid oil phase is completely immobilized, sort of trapped within a three-dimensional network.
And our mission today is to explore the sources that show how this technology, specifically using this really abundant polymer called ethylcellulose, has moved way beyond just fixing food textures. We're looking at a shortcut, really, to being well-informed about how these EC oleogels serve as advanced, customized delivery systems for everything from, like, fragile probiotics to active pharmaceutical ingredients.
And even how they are radically improving outcomes in complex situations like severe wound healing. It's quite a range.
It really is. So the key material, the scaffolding as you called it, is ethylcellulose or EC. Understanding how this particular polymer builds and structures its network, that seems to be the key to understanding its massive potential across all these different health applications.
Absolutely. It's all about the architecture. How you build the cage determines what you can do with it.
So let's begin with our star material, ethylcellulose. Why EC? Well, you mentioned abundance. It's derived from cellulose, right? Which is literally the single most abundant polymer on Earth.
That's right. And that immediately checks two huge boxes for any kind of industrial or biomedical use.
Yeah.
It's highly available and inherently inexpensive. You need scale for these things to work in the real world.
Makes sense. And safety.
Yeah, it's generally recognized as food grade or near food grade globally, which definitely smooths the path for commercialization, especially in food and oral drug delivery. But the science of how it structures oil, that's what's truly elegant, I think. EC forms these gels when you dissolve it in liquid triglycerides, but there's a catch. It requires heat, a fair bit of heat, actually.
Okay. So you can't just stir it in, like, say, flour and water at room temperature. You have to melt the environment, so to speak.
Melt the environment, or at least
Wow.
melt the polymer, yeah. You have to heat the EC powder above its glass transition temperature. It's TG, which is typically somewhere in the range of 130 to 140 degrees Celsius. Depends a bit on the specific type of EC.
That's pretty hot. What happens then?
Well, this intense heat causes the normally rigid polymer chains to sort of loosen up, become more mobile, and partially solubilize within the oil. It allows them to intermingle and start interacting at a molecular level in a way they can't when they're cold and rigid.
Okay, so that's the mixing, the melting phase. The network itself must form when you take the heat away then.
Precisely. The process is thermoreversible. As the whole mixture cools back down, the EC polymer chains return to their rigid, glassy state. But because they got all mixed up in the oil during heating, as they stiffen, they form hydrogen bonds. These are those weaker but, incredibly numerous non-covalent interactions. They form among the ethoxy and hydroxyl groups along the EC strands. This stiffening and bonding creates the stable, physical, three-dimensional network that actually entraps the oil phase.
And that thermoreversibility, that sounds absolutely critical for manufacturing. It means the material can be molded, shaped, processed, right? And the final structure depends directly on how quickly or slowly you heat it and cool it.
Exactly. Those heating and cooling kinetics are critical. It gives manufacturers pretty fine control over the final product texture. You could target a soft, spreadable butter replacement or maybe a much more rigid structure for, say, a topical drug patch.
Okay, and that control leads us right into the mechanical strength. How firm or soft is it? The sources seem to illustrate there's a massive amount of tunability just based on how much EC you put in the polymer concentration.
Yeah, concentration is the first big lever you can pull. The research suggests that concentrations around 10% EC by weight are often the sweet spot for food applications, mainly because they mimic the texture of traditional solid fats quite well.
But it's sensitive, isn't it? I saw a mention that if you drop below that 10%, say down to only 4% EC.
Right. At 4%, researchers found the material failed to form a self-standing gel network at all. It just didn't work. The polymer chains apparently couldn't link up sufficiently to trap the oil effectively. It remained too fluid.
And the other extreme, what if you push the concentration way up, like 33%?
Well, contrast that failure at 4% with what happens at 33% EC. At that ratio, the result is described literally as a rock-hard solid.
Wow.
That incredible span from complete failure to, near concrete consistency, it just shows that the structuring capacity is highly nonlinear. It's incredibly sensitive to that ratio of polymer to oil. You really have to dial it in, find that Goldilocks zone for whatever application you're aiming for.
Okay, so concentration is one big factor, but it's not just how much EC you put in. The sources also emphasize the size of the polymer chains themselves. The molecular weight matters a lot too.
It matters immensely, yes. EC is commercially available in various viscosity grades, often measured in centipoise or CP. You might see grades like 10 CP, 45 CP, or 100 CP. This measurement essentially gives you an idea of how long those individual polymer strands are. Higher CP means longer chains,
And longer chains mean stronger gels.
dramatically stronger. When researchers tested the mechanical strength, they often measure this using something called force at maximum penetration. The 100 CPEC resulted in substantially higher mechanical strength. We're talking forces exceeding 150 newtons in some cases. Now, to put that 150 newtons in context for you, that is a genuinely structural material. It's significantly harder than, say, commercial butter or even some types of soft plastic.
Okay, so conversely, if the polymer chains are shorter, like that 10 CP grade you mentioned.
With the shorter 10 CP chains, the gels exhibited pretty low strength. Often they found no significant difference in hardness even when they used different types of oils. So the takeaway seems really clear. Longer polymer chains, even if you use the same concentration, create a far more robust, entangled, and interconnected network. They're just better at trapping the oil with extreme rigidity.
Fascinating. So concentration controls density, molecular weight controls entanglement. But there's a third factor you mentioned, the oil itself.
Yes, and this is where it gets quite interesting. The type of oil you choose to trap isn't just a passive filler. Its chemical nature actually influences the final strength. The strength of the oleogel correlates strongly with the fatty acid composition of the oil, specifically its degree of unsaturation.
Wait, unsaturation, like omega-3s versus others. How does that work? You'd think the oil is just sitting there.
It's not just sitting there, apparently.
Yeah.
For example, if you use flaxseed oil, which is very high in linolenic acid, that's an omega-3 fatty acid, with 3 double bonds, 18.3, the resulting gel is substantially harder. We're talking a hardness value around 6 newtons. Meanwhile, if you make gels from soybean or canola oil, which have less unsaturation overall, they were much softer, more like 1.5 to 2 newtons. Big difference.
So what's the theory? Why does more unsaturation make it harder?
Well, the proposed mechanism connects the structure and the chemistry quite beautifully. The idea is that oils with a higher degree of unsaturation, meaning more double bonds along those fatty acid chains, are thought to pack more tightly within the tiny interstitial spaces of the polymer network. They just fit together better, more densely.
Okay. So higher molecular density within the scaffolding leads directly to a firmer, more structurally rigid gel overall. That makes sense. So the choice of liquid oil, which you might make for nutritional reasons, simultaneously becomes a primary structural parameter. You're tuning texture and nutrition at the same time.
Exactly. It adds another layer of complexity, but also another layer of control.
Okay, now we have a good picture of what controls the outside feel, the macro texture. But to really understand why it all works, we need to look inside at the microstructure. And this apparently introduces a major scientific challenge, imaging these things. Standard techniques don't work well.
That's right. Standard polarized light microscopy, which works great for things like fat crystals, is pretty much useless here for EC oleogel. Because as soon as you heat EC above its glass transition temperature, any original crystalline structure it might have had just disappears entirely. It melts. And when it cools and forms the network, the structure it forms is, well, it's complicated paracrystalline or amorphous. It's not a regular crystal structure that you can easily visualize with polarized light.
So researchers had to get creative. They turned to more advanced techniques.
They did. Techniques like cryoscanning electron microscopy or cryosem, that lets you freeze the sample rapidly and look at it in a near-native state under vacuum. And they often combine this with solvent extraction. So after freezing, they'd use chemicals like isobutanol or maybe acetone to carefully wash away the liquid oil phase.
Why wash the oil out?
It's crucial. By removing the oil after the structure is frozen in place, you are left with just the polymer scaffold itself. That allows you to see the network architecture much more clearly without the oil obscuring the view.
And what did that reveal? What does the inside look like?
What cryosem revealed consistently wasn't just a random tangle of polymer strands. It showed a highly organized, almost coral-like network of polymer strands or bundles. And these bundles surrounded distinct oil-filled pores.
Coral-like. Okay, I can picture that. And they could measure the size of these pores, the spaces where the oil was.
Yes, they could. They typically range from approximately 3.0 to 4.5 micrometers in size, so pretty small on the micron scale.
And did those measurements line up with the mechanical properties we talked about, like concentration effects?
They did, beautifully. For example, the pore size consistently decreased as you increase the EC concentration, which makes perfect sense. More polymer means a tighter cage, smaller holes. It also seemed to decrease slightly with increasing oil unsaturation. Remember the flaxseed oil gels being harder? Well, soybean oil gels, which are also relatively unsaturated, tended to have slightly smaller pores than canola oil gels, which are less unsaturated overall.
Okay, so far so good. Concentration, unsaturation, they affect pore size, which affects hardness. But what about the molecular weight? The 100 CP versus the 45 CP? Did the super hard 100 CP gels have much smaller pores?
And here's where the investigation truly deepened things and confirmed that mechanical strength isn't just about one thing. It relies on multiple independent mechanisms. When they compared gels made with the standard 45 CPEC to those made with the rock-hard 100 CPEC, there was no significant difference observed in pore size.
Wait, hang on. If the 100 CP gels were demonstrably significantly harder, but the holes they created inside were basically the same size as the softer 45 CP gels, that means the increased hardness isn't just about creating a tighter mesh or smaller pores.
Exactly. That's the crucial insight. It strongly suggests that the polymer molecular weight affects mechanical strength through an alternate mechanism. The thinking is it's likely due to more efficient polymer entanglement. Those longer 100 CP chains are just much better at interlocking and forming hydrogen bonds more effectively along their entire length, creating a tougher network overall. It's not simply about the size of the pores they create.
Wow. Okay, so this microstructural insight really confirms you have at least two separate powerful levers to tune your final product. Concentration, which seems to primarily affect pore size, and molecular weight, which affects the chain entanglement and the overall robustness of the network structure itself.
Precisely. And understanding those distinct mechanisms is what allows us to start engineering these materials for very specific, demanding applications.
Right, and that structural tunability you just described is the perfect bridge. It takes us from basic food science right into these advanced biomedical applications. Let's start with internal delivery inside the body. Specifically, customizing release kinetics in the gastrointestinal, or GI, tract. This sounds absolutely critical for sensitive ingredients.
Oh, it is. This is genuinely one of the biggest challenges in pharmaceutical and nutraceutical delivery. How do you protect a delicate, active payload, especially something alive, like probiotic bacteria, from the extremely harsh, lethal environment of the stomach? And then there's the initial assault of bile salts in the duodenum, the first part of the small intestine.
Yeah, it's a gauntlet down there.
It really is. You need a structure that can withstand that initial enzymatic attack and acidity,
Yeah.
but then release its contents later where they're needed.
And oleogels are proving to have a compelling solution here.
Very much so. Studies using Lactobacillus reuteri, which is a common and well-studied probiotic, encapsulated within these EC oleogels, show immense promise as controlled delivery systems. The oleogel structure offers a physical, lipid-based shield. It protects the bacteria against that lethal environment they encounter during in vitro lipolysis tests, which simulate digestion.
And what stands out in the data? Is it just protection or release too?
It's both. What's really striking is the sheer survivability over time. Simple formulations, like just mixing the bacteria in non-structured oil, allow for rapid breakdown and failure. Most of the bacteria die off quickly. But the EC oleogel formulations maintained a continuous, slow release of viable living cells into the surrounding solution over a much longer period. That structural barrier essentially retards the initial enzymatic breakdown of the oil, acting as an effective shield until the bacteria reach a potentially safer environment further down the GI tract.
Okay, so it's a controlled release. And the mechanism of this release is apparently so quantifiable, so predictable, that researchers successfully applied a classic pharmaceutical modeling tool, the PEPIS model, to analyze the digestion kinetics.
Yes, that's a key finding. Using the PEPIS model is sort of the ultimate proof that the oleogel is acting as a sophisticated drug delivery vehicle, not just, a passive lump of fat.
Can you remind us briefly what the PEPIS model does?
Sure. The PEPIS model is a standard quantitative tool. It's widely used in pharma to analyze how a drug or active compound is released from a polymer matrix over time. By measuring the release rate and fitting that data to the model's equation, you get a mathematical exponent, usually denoted as n. And the value of n correlates quite precisely to the underlying physical mechanism that's governing the release.
So the N value tells you how the structure is letting go of its contents. What are the main mechanism groups they identified for EC oleogels based on this model?
Right. Most standard EC oleogels, just given their inherent structure, tend to fall into the diffusion-limited group. Here, the physical structure itself, the polymer network, slows down digestion simply by making it harder for digestive enzymes to penetrate into the matrix and break down the oil. For this mechanism, the N exponent typically falls between about 0.35 and 0.65.
Okay, diffusion limited. Makes sense.
Any others? Yes, there's also the surface-limited group. In this case, the release rate is primarily governed by the exposed surface area of the gel that's available for enzymes to attack. As the surface erodes, more is released. Here, the N values approach 0.85 up to about 1.
But the sources mention a third group, which sounds like where the real engineering comes in. The disintegration limited release. This was described as the aha moment for achieving hyperspecific targeted delivery.
This is where the structural engineering becomes really quite genius, I think. Think about probiotics again. If you want a probiotic like L. reuteri to actually work, to colonize effectively, you don't really want it released in the stomach or even the first part of the small intestine. Ideally, you want it to wait until it reaches the later parts, the ileum or even the colon. Those are the preferred sites for probiotic action.
Okay, so how do you make a structured oil, which is designed to be stable, suddenly just disintegrate exactly where you want it to, much later in the GI tract?
They achieved this very clever trick by deliberately incorporating hydrophilic powder disintegrants into the oleogel formulation during manufacturing. These are essentially dry polyelectrolytes materials that love water.
But the oleogel is oil-based.
Exactly. So these hydrophilic powders don't initially react much with the oil base. They just sit there, embedded in the network. But once that oleogel moves further down the small intestine, it starts to encounter and absorb more water from the intestinal fluids. As it absorbs water, the disintegrant powder particles swell up rapidly, almost explosively. And this swelling ruptures the polymer network violently from the inside out.
Wow, so the water absorption acts like a delayed action fuse, triggered by the environment itself.
Precisely. It's a programmed structural failure. And this rapid disintegration leads to an exponent NE in the Pepys model that's greater than 1. That signals something called supercase 2 transport, which basically means the release or digestion is happening much faster than simple diffusion or surface erosion could explain. Physically, what you see is a very low initial release during those dangerous early phases of digestion, followed by a sudden massive burst of content release later on. Exactly where you want the probiotic to be delivered for maximum colonization potential. That ability to tune a food-grade polymer system to achieve that kind of almost surgical-like release precision is incredibly significant.
It really is. And I imagine this kind of targeted release is equally important for delivering certain nutraceuticals, especially those lipophilic bioactive compounds, the ones that are poorly water-soluble and often suffer from low bioavailability when you just consume them in their raw state.
Absolutely. Curcumin is the perfect case study here. It's famous for its potential anti-inflammatory properties found in turmeric.
Yeah.
Hugely beneficial potential, but it's notoriously sensitive to oxidation, and it's very poorly absorbed by the body on its own.
And oleogels helped.
They did. Studies show that EC oleogels successfully protected the encapsulated curcumin from oxidation. And importantly, including the curcumin compound didn't seem to interfere with the EC gel network assembly itself. This meant they could maintain successful loading of the curcumin and, critically, achieve high bioaccessibility, meaning the amount available for absorption. Up to 80% bioaccessibility was reported in some formulations tested under simulated fasted state conditions. That's a huge improvement potentially.
Okay, 80% is impressive. But the research also highlighted something important. It's not just any oleogel that works best. The specific material used to create the oleogel network, the gelator, matters dramatically for how well the curcumin is absorbed.
Yes, absolutely. The nature of the oleogelator matters immensely for absorption outcomes. For instance, oleogels created using different gelators like beta-sitosterol and gamma-lursinol. These are plant sterols that form a different type of network compared to EC. They actually demonstrated the highest curcumin bioaccessibility, comparable even to just consuming the curcumin dissolved in non-structured liquid oil.
Interesting. So those networks didn't hinder absorption. What happened when they used oleogels based on crystalline network structures, like those made with monostiloglycerols, MAGs, or maybe rice bran wax?
That's where they saw a problem. Those tighter, more rigid crystalline networks resulted in significantly lower bioaccessibility for the curcumin.
Why would that be?
Well, this structural difference suggests that the very dense, highly ordered crystalline network might physically interfere with the curcumin's release or its emulsification during the digestion process. It essentially makes it harder for the body to get at and absorb the compound. It really reinforces the core theme we keep coming back to in this dive. The final material structure dictates the biological outcome. It's not just about trapping the ingredient, it's about how easily the body can access it later.
Makes sense. And EC oleogels were good for other nutraceuticals too.
Yes, other examples were mentioned. EC oleogels were also found to enhance the stability of beta-carotene against oxidation, proving their role as robust protective barriers for sensitive compounds. And man-based oleogels, despite the curcumin issue, have been used successfully to deliver other compounds like quercetin. So it's about matching the right structure to the right payload and the desired relief profile.
Okay, let's shift focus now. We've been inside the body. Let's move outside and look at topical applications applying these materials to the skin. Here, that structured oil provides a beneficial lipid barrier, and this area seems to be seeing tremendous uptake for both drug delivery and advanced wound care.
Yes, the general advantages for topical administration are really enormous. First, because oleogels are fundamentally oil-based, but can be engineered to hold both water-loving, hydrophilic, and oil-loving hydrophobic medications. They are extremely versatile carriers. You can load a wide range of drugs into them. More importantly, perhaps, their lipid-rich composition significantly enhances skin absorption, especially for lipophilic drugs. They interact very well with the skin's own outermost layer, the stratum corneum, which is itself lipidic. This helps drugs penetrate.
And from a patient's point of view, you mentioned texture earlier.
Exactly. Texture is a huge win here. They generally have a smooth, non-greasy feel, which is often a massive improvement over traditional sticky lotions or very oily ointments. And better patient compliance, people being willing to actually use the product regularly, means better treatment outcomes. That's often overlooked in pure material science, but it's critical in medicine.
Good point. And stability. Drugs breaking down is always a concern.
Oleogels offer great stability too. Their oil-based matrix acts as a powerful physical shield, protecting the active pharmaceutical ingredients, the APIs, from environmental degradation, things like light, air, moisture. This is crucial for ensuring a good shelf life and maintaining the drug's efficacy over time. Plus, as we're about to discuss in more detail, they offer an intrinsic and often overlooked resistance to microbial infection just by being oil-based.
Okay, let's touch on that microbial resistance in the context of something like antifungal therapy. You mentioned conventional creams sometimes struggle.
They can. Conventional creams or lotions often struggle to penetrate deep enough into the skin layers to reach the fungal reservoirs where the infection really lives. Oleogels, with their enhanced skin penetration properties, are helping to overcome those limitations.
Are there specific examples?
Yes, the sources mention specific oleogel formulations being designed for a whole host of common antifungal drugs. Things like clotrimazole, miconazole, terbinafine, and ketoconazole. These are used to target really common and persistent infections like athlete's foot, ringworm, and other fungal skin issues. The idea is that the oleogel structure can provide a sustained, long-acting release of the drug right at the site of infection, which is often necessary to fully eradicate those stubborn fungal colonies over the required treatment period.
Okay, that makes sense for antifungals. Now, let's dive into the really complex world of wound healing. The sources detail a very important study that sounds quite comprehensive. It used a standardized rat scald burn model, creating a severe second-degree burn, and then compared 21 distinct topical formulations. Critically, it compared hydrogels versus oleogels, many of which were enriched with various plant extracts known for healing properties.
Yes, this study provides some compelling evidence. The comparison was designed to be rigorous, looking at traditional water-based hydrogels against these newer oil-based oleogels, and the results. Statistically, the oleogel-based formulations showed significant advantages.
Why would an oil-based gel be better for a burn? Intuitively, you might think water would be good.
Well, oleogels function primarily as occlusive barriers. They prevent excessive water loss from the damaged tissue, which is critical for maintaining a moist wound environment conducive to healing. At the same time, they supply necessary lipids that can aid in skin barrier repair. Hydrogels provide moisture, yes, but they don't provide that lipid barrier or the same level of occlusion.
Okay, so what were the key statistical results showing this advantage in the study?
In terms of wound closure, how quickly the wound physically shrinks, the oleogels significantly reduced the wound surface area at critical checkpoints, specifically on days 9 and 14 post-burn compared to the hydrogel groups. This acceleration indicates faster reepithelialization, meaning new skin forming over the wound, and likely better quality granulation tissue formation underneath.
And hydration? Did they measure that?
They did. And perhaps counterintuitively, the oleogels provided consistently higher skin hydration levels over the study period. By day 14, the oleogel-treated skin averaged around 45 hydration units, compared to the hydrogel groups, which were lagging slightly behind, averaging closer to 40 units. Now, that 5-unit difference in hydration might seem small, but in wound healing terms, it represents a substantially more supportive and less stressed healing environment.
Interesting. Higher hydration from an oil base. And did the quality of the healed tissue also show differences when they looked under the microscope? The histology?
It absolutely did. The histological evaluation looking at thin slices of the tissue confirmed the superior healing quality seen with the oleogel treatments. Oleogel-treated wounds resulted in substantially lower inflammation scores. They dropped down to around 0.5 by day 14, which is very low. And conversely, they showed higher epithelialization scores by day 21, indicating that the tissue repair process was more complete and less marked by chronic inflammation compared to the hydrogel groups.
Were certain ingredients particularly effective when added to the oleogels?
Yes. The study also looked at enriching the gels with plant extracts. Formulations containing extracts like Boswellia serrata, frankincense, and Ocimum basilicum, basil, consistently achieved the very best wound healing outcomes within the oleogel groups. This suggests that the oleogel acts as an excellent carrier, effectively delivering these anti-inflammatory and potentially regenerative compounds to the wound bed.
Okay, and this brings us back to that crucial point you made earlier about intrinsic microbial defense. Did the histology reveal anything about bacteria on the wounds? This is huge for burns.
This is perhaps one of the most definitive findings from that study, and really highlights a key advantage of the oleogel base itself. Researchers specifically noted visible microbial colonies developing on the wounds treated with the blank hydrogel, meaning the hydrogel base itself offered no protection against infection. Bacteria grew quite readily.
But not on the oleogels.
Critically, no such colonies were observed on the wounds treated with the blank oleogel control, nor on any of the oleogels that contained the plant extracts.
Wow. So the oil structure itself prevents bacteria from growing.
It seems so. The oleogel's oil-based, water-poor matrix is inherently resistant to microbial colonization and development. It's just not a hospitable environment for most bacteria compared to a water-rich hydrogel. This offers a profound advantage in burn care, where infection is a constant, often life-threatening risk. So the oleogel isn't just about delivering a drug or providing hydration. It's potentially making the wound environment itself significantly safer for the natural healing process to occur. It's really quite astounding when you see the breadth of these biomedical applications, isn't it? From gut health to wound healing. But it's critical for us, and for you listening, to remember that a huge amount of this fundamental structural research on oleogels, especially with EC, was originally driven by a very different, perhaps more mundane, but equally important need: solving the fat crisis in processed foods.
Right. Circling back to the beginning, the original impetus was the urgent need to substitute traditional solid fats in foods. Things like partially hydrogenated oils, or even lard and butter in some cases. These were essential for texture, mouthfeel, shelf life, but nutritionally problematic.
Exactly. We know trans fatty acids, often found in those partially hydrogenated oils, are arguably the worst type of fat for cardiovascular health. They cause the greatest increase in LDL, the bad cholesterol, and uniquely, they're the only type of fat known to simultaneously decrease HDL, the good cholesterol. That's a double whammy. And even saturated fats, like palmitic acid found in palm oil or animal fats, are something health authorities recommend reducing. So the food industry faced a massive challenge. How do you use heart-healthy, highly unsaturated vegetable oils like canola or soybean oil, but somehow maintain all the functional properties, the texture, the structure, the stability that solid fats provided?
And EC oleogels emerged as a potential solution pretty early on.
Yes, they proved immediately successful in certain applications. The sources specifically cite their use as a 100% replacement for traditionally added animal fat in comminuted meat products. Think things like frankfurters, hot dogs, breakfast sausages.
And it worked. How well?
Remarkably well, according to the studies. This substitution dramatically reduced the saturated fat content of the final product, which was the main nutritional goal. But critically, it did so while maintaining a sensory texture, the firmness, the juiciness, the mouthfeel that was functionally indistinguishable, or at least not significantly different, from the control product made with traditional beef fat.
Okay, that seems almost counterintuitive, doesn't it? Especially if you've ever tried cooking at home and just swapping liquid oil for solid fat in something like a burger or sausage patty. If you just replace beef fat with plain, ungelled canola oil, the final product usually becomes significantly chewier, sometimes really tough, right?
Absolutely. Simple liquid oil substitution often fails texturally. It can make meat products significantly tougher, sometimes measured as 3 times chewier in instrumental tests.
So why does that simple liquid oil substitution fail so badly, but the structured EC oleogel succeed in mimicking the texture of solid animal fat? What's the mechanism?
The mechanism is actually a really neat structural surprise. It turns out it's all about droplet size and surface area. When you use simple liquid oil in a meat batter, during the intense chopping and mixing process, that oil gets dispersed into literally thousands and thousands of very, very small droplets throughout the meat protein matrix.
Okay, tiny droplets. Why is that bad for texture?
Because having all those tiny droplets creates a massive total surface area for the oil. And this huge surface area allows for a very large degree of protein-lipid interaction during cooking. The meat proteins, particularly muscle proteins like myosin, can coat these small oil droplets extensively. This strengthens the overall protein network as it coagulates during eating. And that stronger protein network is what makes the final product tough and chewy.
Ah, I see. So the goal of using the EC oleogel isn't just that it's solid at room temperature, it's about controlling the size of the oil inclusion during processing.
Exactly. That's the key insight. The EC oleogel, because it starts as a solid or semi-solid mass, resists fragmentation much more effectively during that high shear mixing and emulsification process compared to liquid oil. As a result, it causes a greatly increased fat globule size in the final meat batter. The studies showed the median fat globule size increased by over 130% when using the oleogel compared to using the same amount of ungelled liquid oil.
So bigger chunks of fat, essentially, and how does that help the texture?
By clustering the fat into these much larger structures or globules, the oleogel drastically decreases the total surface area that's available for the meat proteins to coat and interact with.
Less interaction area means a wicker protein network around the fat.
Precisely. By reducing that protein-lipid interaction area, you effectively weaken the surrounding protein network just enough during cooking to replicate the softer, more desirable texture of the original product made with animal fat. It's a fantastic example of using physical structure the size of the fat inclusion to solve a complex functional problem rather than relying on chemical interactions alone.
Oh.
But, and this is where it gets really mind-bending, this work on texture, which was primarily focused on just mimicking beef fat structure, inadvertently led the researchers involved to an even more profound discovery, one that genuinely challenges decades of fundamental meat science theory regarding how these meat emulsions are stabilized in the first place.
Okay, now you've got my attention. Challenging decades of theory, what did they stumble upon?
Well, for literally decades, the stability of comminuted meat products, things like sausages, bologna, has been explained by a core belief. The belief is that certain muscle proteins, specifically myosin, migrate during processing to the surface of the dispersed fat globules and form robust, stabilizing films around them. These are called interfacial protein films, or IPFs.
Right, I think I've heard of that. The idea is the protein coats the fat and stops it from coalescing, basically stabilizing the emulsion against heat and processing.
Exactly. That theory has been the cornerstone of meat emulsion science for a very long time. It's in all the textbooks. However, when these researchers, working on the oleogels, started using highly complex and very sensitive analytical tools to probe these interactions more directly, specifically things like surface plasmon resonance and UV spectrophotometry, they got a shock. They tested purified protein solutions like myosin and also bovine serum albumin, BSA, directly against highly purified lipid surfaces like stearic acid, palmitic acid, oleic acid layers under conditions mimicking meat processing. And they found a massive disconnect with the established theory.
What did these highly sensitive tools actually show? Did the proteins bind?
Surprisingly, they showed almost no significant binding of those key meat proteins to the purified lipid surfaces under the conditions tested. Almost none.
Whoa, okay, if the binding basically doesn't happen or is negligible, then the long-held belief that myosin forms this purposeful molecular film around the fat droplet just falls apart.
It certainly throws it into serious question. That's a potentially staggering challenge to very established scientific dogma. If the proteins aren't preferentially binding to the fat surface as assumed, then what exactly are those visible interfacial protein films that countless researchers, including myself, have seen under electron microscopes when looking at cooked meat batter? They look like films.
Yeah, if it's not binding, what else could it be?
Well, the alternative explanation proposed in these sources is fascinating. It suggests that the IPS we observe might not be the result of specific molecular binding at all. Instead, they might be essentially a heating artifact, an optical illusion caused by differential thermal properties.
A heating artifact, how would that work?
Think about it. Fat has a much lower heat capacity than water, which makes up most of the meat batter. Therefore, during the cooking process, the very thin layer of protein that happens to be immediately surrounding a fat globule will heat up and denature or cook significantly faster than the bulk protein matrix further away. This difference in the rate and perhaps the nature of denaturation could make that thin layer of protein surrounding the fat appear visually distinct under a microscope. It might look denser or different structurally. So we might have been interpreting this visually distinct layer as a purposeful protein film that formed due to binding, when in reality we were just seeing a physical deformation caused by localized, faster heating around the fat globules.
That is, wow. So we may have inadvertently relied on the wrong explanation for potentially 50 years or more. This research suggests that the actual stability of these meat emulsions might rely far more on simple mechanical entrapment and the overall physical structure of the protein matrix, which the oleogel technology expertly manipulates by controlling fat globule size, than on the specific molecular properties of protein-lipid binding we always thought were the key factor.
It really does. It fundamentally shifts our understanding of something as seemingly simple as what makes a hot dog stay together during cooking. It suggests structure and mechanics might be far more important than specific molecular adhesion in this system. Hashtag outro, synthesis and final thought. It's really quite astounding when you synthesize this whole deep dive, isn't it? We've seen how one single polymer, ethylcellulose, acts as this kind of structural genius. It takes something as basic as cheap liquid vegetable oil and transforms it into this incredibly versatile controlled release material. And this one material platform provides potential solutions across this huge health spectrum, from tackling the problem of the most deleterious fats in our daily diet to creating these incredibly precise targeted delivery vehicles down in the gut, ensuring sensitive things like probiotics actually reach the colon where they need to work.
And then shifting outside the body, that same mastery of structure is helping protect and hydrate severe scald burns, while simultaneously offering this unexpected intrinsic microbial resistance. It's accelerating healing, and it's solving the practical texture problems of topical medications to improve compliance. Oleogels, particularly these EC ones, really represent a triumph of material science, I think. They demonstrate so clearly how polymer chemistry and, importantly, nanostructuring can be leveraged to solve macroscopic problems in incredibly diverse fields: food, pharma, medicine.
Absolutely. And if there's one overarching theme we've uncovered, it's that the physical structure and the resulting delivery mechanisms often matter much more than the raw chemistry alone. We saw how tuning that three-dimensional network dictates everything from the mathematical exponent and governing drug release kinetics in the PEPAS model, right down to the final perceived texture of an emulsified meat product. It's structure, structure, structure.
And what's so fascinating, especially with that last point about the meat science, is that success in both food and pharmaceuticals seems to be achieved primarily by structuring the material around the active ingredient, or by controlling how that structure interacts mechanically with its surroundings, be it digestive enzymes or meat proteins. This entire deep dive just keeps reinforcing the power of physical structure, sometimes even over long-held assumptions about simple chemical composition or binding.
Which brings us to a final provocative thought for you, the listener, to mull over. If the ultimate goal for food science, for instance, is simply to replicate the texture and the functional stability of traditional solid fats using healthy vegetable oils, and we now have pretty concrete evidence suggesting we can achieve this largely through structural means, perhaps without needing to rely on those decades-old assumptions about molecular-level protein-lipid binding. If physical structure is truly enough, well then what other completely non-traditional structured systems might we be able to use in the future? Systems perhaps entirely unrelated to polymers like ethylcellulose, things we haven't even begun to consider yet, simply because they provide the necessary mechanical stability and texture, regardless of their chemistry. The future of both food and maybe even drug delivery might just be about finding or designing the perfect microscopic cage.